Hey folks, I think I'm live now. This is the first time I've done this, so it's a little bit of a different, there we go. Yeah, I am live. Okay. Um, hey, my name's Ray Midget. I'm with the Historic Port of Washington, and we are a group of history buffs in Washington, North Carolina. And this is my first Facebook Live video, so I'm hoping everything turns out well and don't have any technical glitches. If you want to comment and just tell me that you're there, so I know that at least somebody's watching, I'd appreciate that. Um, Today, I want to talk about the what I'm going to call past Pamlico pandemics, and let me switch to the slideshow here, and so I can get started here in a second. I see Mary Dawn's there. Yay! Thank you, Mary Dawn, for letting me know that at least the feed is going out and you can see it. But anyway, I thought because today we're going through this deal with the COVID-19 pandemic and all the social distancing that's going on and all the concern about getting businesses back, I thought it'd be a good time to go back and look at past uh, pandemics. And we're not going to look at just pandemics, but we're going to also talk about things that weren't quite as widespread as the COVID-19 is today. But one of the things we're going to focus on is going to be the Spanish flu of 1918. That was definitely a pandemic, and it definitely had a significant impact on Beaufort County. So anyway, so I'm going to get started. Let's see if we can go to the next slide here. Okay. During the 19th and the early 20th century, widespread disease was an ever-present concern for the inhabitants of eastern North Carolina. These diseases were diseases such as yellow fever, cholera, smallpox, and malaria. And all of these were not uncommon during the 18th and the 19th and the early 20th century. Because we didn't have the science and the medicine that we have today, just about when someone caught one of these diseases, the only option for care was, looks like I'm having trouble with the video here. Hang on a minute. I don't know what the problem is here, folks. Tell me if you can see me. Stream health, let me look at that. Okay. It tells me things are going out, but I'm not getting a preview on my end. Okay, I'll continue with this presentation and see what happens here. Because today we don't have any treatment or any type of vaccine for the COVID-19, we're forced to deal with this disease much like they did in the 19th and early 20th centuries. So let's take a look back and see what we can find out about So, what did 19th century North Carolinians believe about the cause of most infectious diseases? The thought at the time was that diseases were caused by a noxious form of bad air emanating from rotten organic matter. Miasma is what it was called. And miasma is a ancient Greek term for pollution. So the theory assumed that diseases were the product of environmental factors such as contaminated water, foul air, and poor hygienic conditions. Such infections, according to the theory, were not passed between individuals, but would affect those in the vicinity of those vapors. So that those foul smells coming from sewage, raw sewage, and from the swamp, stagnant water, and from decomposing garbage, etc. Those vapors contained particles that if you breathed it in, it would cause these diseases. As a matter of fact, the Italian phrase for bad air is malaria. In speaking about the causation of malaria, a North Carolina physician in 1851, Charles E. Johnson, argued that marsh miasma cannot be the cause of the disease. So even though we were able to scientists were able to see microorganisms, they had yet put any type of connection between those microorganisms and infectious diseases. And Dr. Johnson was arguing as early as 1851 that it wasn't from these miasma or these foul odors coming out of decomposing material. But by the latter part of the 19th century, most physicians, including Dr. Johnson, prescribed to what we now call the germ theory of infectious disease. That says that the infectious diseases are caused by microorganisms such as bacterium, protist, fungi, and viruses were some of the culprits in causing these diseases. We know now, for example, that malaria is caused by a single-cell microorganism from the Plasmodium group, and not just bad air. It wasn't until the turn of the century that the mosquito was discovered to be the vector by which malaria is transmitted. So it wasn't the swamp. It was the swamp that the mosquito lived in. No reliable statistics regarding malaria morbidity or mortality exists for North Carolina prior to 1900. Washington's low swampy surrounds promoted the breeding of mosquitoes and thus the spread of malaria. So malaria has been a problem in eastern North Carolina as well as much of the other temperate and tropic parts of the world because of the mosquito. Reports of intermittent chills and fever show up in early letters and reports, but nearly any fever in the early 19th century could have been described as malarial, regardless of cause. Being a trading port provided Washington the opportunity for ships from other regions to bring contagious diseases to town. To protect the town from disease, an ordinance was passed establishing a quarantine ground. And here's the ordinance. In 1853, the ordinance stated, all masters and pilots shall hereafter anchor their vessels which have an infectious disease on board or which came from any place that was at the time of her sailing infective. The pilot was then to proceed with his boat with a flag in her bow up to town, opposite the street leading to the courthouse. We all know what street that is. That's Market Street. There remain in the stream until they shall report himself, receive orders from said commissioners on what to do. It further said, be it further known that all vessels arriving at this port from any port south of Wilmington, North Carolina, between June the 1st and November the 1st are required to anchor in the quarantine grounds. Okay. And if you, I went too far. Hang on just a second. If you look at this chart on the left, that's a chart of the Pamlico River from the 1800s, and Washington is at the top, circled in red, and about 3 or 4 miles downriver were the quarantine grounds. They were basically at Hills Point, off of Hills Point in the Pamlico River, and that is where vessels coming to town would have to be would anchor and have to come by boat up to town, and then be checked in by the commissioner of health in the town. So next time you go down that part of the river, you can think about that. So where did this term quarantine come from? Just out of curiosity, I took a look, and it so happens that it's an Italian word that means a period of time of 40 days. Back in 1343, 1350, the bubonic plague was ripping through Europe, Asia, and the Middle East. The sweep of the plague resulted in one of the biggest die-offs in the history of human history. Anywhere from 25 to 75 million inhabitants of the earth perished. Italian cities such as Marseilles, Pisa, and various other Italian cities adopted the practice of a 40-day period of isolation for ships from these plague-affected areas. And that 40-day period of isolation was known as a quarantino. And so today we have that term quarantine. I want to talk a little bit about cholera. Cholera was common in the 19th century. It's a bacterial disease, and it causes severe diarrhea and dehydration. It's spread by drinking unsafe water and eating unsafe food that has been contaminated with human feces containing bacteria. If treated quickly, mortality rates are less than 1%. If untreated, mortality rates can rise anywhere from 50 to 60%. Poor sanitation was most likely the cause of a case of cholera that struck Washington in the around 1834. Of the 9 reported cases, 4 of those cases were fatal. Poor sanitation was most likely the cause, and perhaps eating some bad oysters could have also been the cause of this particular cholera outbreak. There are quite a few of patent medicines and home remedies that were used to treat cholera. And an 1840 North Carolina newspaper published a cure for cholera, which stated, immediately after the chill, take 20 to 30 grains of hippo, which was an old medicinal drink made of wine mixed with spices. I was glad to find out that had nothing to do with hippopotamus, but it has to do with the Hippocratic Oath, and short for that, I guess. But to take that with 8 to 10 grams of calomel, which was a patent medicine that contained mercury chloride, and work off the puke that resulted with snake root tea. When pain is violent in the breast and throat or head, it states, apply a blister of plaster of mustard, flour, or vinegar. I'm not sure I would be too keen on that particular treatment. But you'll see here a couple of ads for patent medicine, And the one on the right, Dr. Tassaneri's Rose cigarettes. It was proven that if you put the bacteria that is cause cholera in the smoke of this particular cigarette, that it would kill those organisms. And so they were saying you should smoke their cigarettes. Not sure that would work quite well. Yellow fever was also a problem around Washington because it was primarily spread. It was spread by a female mosquito, and it only infects humans and other primates and several other types of mosquitoes. Newspapers in the state reported a yellow fever outbreak in Washington in October of 1843. It was so bad that other nearby towns began prohibiting citizens to travel to Washington. This is from the Greenville, North Carolina newspaper, and it states actually the commissioners of Greenville have passed an ordinance prohibiting all intercourse either directly or indirectly between this place and Washington for 30 days from this date, being satisfied that yellow fever or some other dangerous disease prevails there. And if you did not abide by this ordinance, they would fine you $50. And so I guess that was sort of a case where early on Washington was being shut down. Business in Washington was being shut down because nothing could travel between here and Greenville. That included goods on the river, or not just people visiting, but the business of transfer of goods between Greenville and Washington. Washington recorded during this outbreak 43 deaths from this fever between August the 31st and October the 4th. So it was a fairly significant health event. They also noted that 55 families left town for about a week during that time to avoid the infection. So we were doing some social distancing then. Let me back up one here. Local newspapers got the word out once the fever subsided and it was safe to visit Washington. The suggestion was that the concerns were overblown by calling it the yellow fever panic. Perhaps that might be today called fake news. Smallpox is a serious infectious disease caused by the Viola virus. People who are infected with smallpox develop a fever and a distinctive progressive skin rash. So smallpox was a definite problem or issue in Washington and in eastern North Carolina during the 19th century and early 20th century. Even though earlier, towards the end of the 18th century, the physicians, the doctors, the scientists knew that you could protect people and that you could create an immunity within your population by doing some sort of vaccination, so that was done, but not everybody apparently did that, or it wasn't always done, wasn't always widespread. Here's talking about this is a quote from Dr. William B. Rodman when he was talking about, he was doing a speech for the opening of the very first hospital in Washington. And he was talking about a previous outbreak of smallpox in town. He said, one of our citizens developed the dread smallpox. What was the community to do? We had no hospital or place for treatment. Hastily, a building known as the Pest House was constructed on the sand ridge between the swamps on the south side of the river near where the Washington Packing Company now has its plant. There, the doctors of the community rendered treatment. So this pest house was between Washington and Chocowinity, right off of Highway Business 17. If you were to go from Washington to Chocowinity and turn right at the traffic light on Highway Business 17, where you turn to go to Wichards Beach or Wichards Beach Road, you took a right, then you would go down in that area, and that's where the pest house was. It doesn't seem to me like a good place to take somebody who was sick, because there might be some other diseases down there in the swamp that you went to you didn't want to catch. So they would take these people with smallpox, and they would actually take them to the pest house and keep them there and treat them until they were and care for them until they actually recovered from the smallpox. This is a picture. The picture that you see is a picture of a pest house somewhere else in the country. In the Washington Progress newspaper, I found this little blurb about smallpox patients at the pest house were 2 in number and have been discharged, and there is no smallpox in the county now. So this outbreak was around the turn of the century, around 1900. There were a number of instances in the Washington newspaper, the Washington Progress, that I found where doctors and others had been reimbursed by the county for treatment of smallpox patients. See here, we see a couple of doctors that were reimbursed for smallpox merchandise for the patients. A gentleman apparently who was looking after the pest house, and then Dr. J.G. Blunt attending the smallpox cases. So, what did they do in town to try to improve public health in Washington? You know, back in the 19th century, we didn't have a public water system. We did not have a sewer system. There, garbage and trash, there wasn't pickup, so you were responsible for doing something with your garbage and your trash. And unfortunately, some people just threw that stuff to the curb and let it sit there, which of course was not a healthy thing to do as far as public health is concerned. One of the things that was done was the establishment of water wells around town. Edmund Harding, in an interview, described what his remembrances of the wells in town. The water supply of the town came from a series of pumps that were mounted on bricked-in wells. Everybody took their buckets several times a day for water. They were scattered around town. Edmund Harding said there was the Wallace pump at the corner of 2nd and Harvey Street, the Episcopal pump on Main Street, which I would assume would be somewhere close to the Episcopal Church, and the courthouse pump, and the Academy pump. The Academy pump would have been on the corner of Bridge Street and 2nd Street, where the Washington Academy was, and there were several others around town. And this is an old Sanborn insurance map of Washington, and from 1885. And you can see in the upper left-hand corner, circled in purple, is it's labeled a well, but on that well was a pump that was at the courthouse. So that was the courthouse pump that Edmund Harding was referring to. And then over on further on down 2nd Street, 2 houses there. One of those had a well behind it. And then on the right, the last house on the right, circled in magenta, is a cistern. I'm going to talk about cisterns in just a minute, but the 2 sources of water in town were wells and cisterns. Quoting Pauline Worthy from the book Washington and the Pamlico, she said, "Those who could afford it back then had cisterns. These were especially constructed tanks for catching and storing rainwater, considered softer and more salubrious than water from the town pump." I had to look up salubrious. I think it means more pleasant. So it must have tasted better. Cisterns are something that I am familiar with. Growing up on Hatteras, the houses that I lived in when I was growing up, especially when I was younger, all had cisterns, and that's how we got our drinking water, was through the cisterns at the house. My house that I grew up in, the front porch was a concrete block cistern, and we built a porch on top of that. These are 2 pictures of old cisterns. The one on the left is a brick cistern with a dome top, and that particular photo is from Ocracoke. And I have seen cisterns like that near old houses in Hatteras also. And I'm sure that there were those here in town too that were very similar to that. And the one on the right, the photo on the right, is a tank-like cistern, which is from Portsmouth Village on Portsmouth Island. That is there next to the Portsmouth School. So anyway, and I know Mary Dawn Midget Judy is watching, and I know she is very familiar with cisterns too. Let me go back to cisterns. Two things, a couple other things I want to add about this. James Ellison is quoted in the Washington and Pamlico of also saying, "Some of the larger and better homes installed cisterns under their back porches. However, it was difficult to keep the bugs, the wiggletails, and the frogs out, and it was a big job to clean them." And yes, it was, because the water that filled those cisterns was rainwater that came off the roof, and no telling what would be in that water once it came off the roof. I hesitate to think about that, but I'm guessing that the wiggletails were probably either small bugs or tadpoles or something. I'm not sure. Okay. Also here, Mrs. Mary McDonald, who lived on East Main Street, had old Joe Jones, her carriage driver, turn the cistern wheel or a pump to force water into a gutter pipe through a hole in the weatherboard at her house to fill her bathtub. And Mrs. McDonald apparently had the very first bathtub in Washington. Again, that comes from Washington and Pamlico. Now this map is from later on. This is from 1904. And in that same speech, Dr. Rodman said, "On May the 20th of 1902, the commissioners of the town conveyed to the corporation 2 lots at the southwest corner of Market and 5th Street, which the town had purchased for use as a burial ground. There our first hospital was erected. Today, that's the location of Fire Station Number 1 in Washington. It was from that point that our first sanitary sewer was constructed. The right to use the sewer from Fowle Memorial Hospital down Market Street to the river was given to any citizen who could reach it and tap it." And according to him, quite a number of everybody who could connected to to that sewer line. And at the same time they ran the sewer line, they ran water lines. And so that was the beginning of the water system in Washington, was in around 1902. And this map that you're looking at is from 1904. And you can see that now, instead of wells around town, you see a 6-inch water pipe that's circled in red on the right. And that one ran down the middle of Main Street, and then there was another one that crossed it and ran up Market Street, and circled in magenta in the left-hand side of that diagram is a double hydrant. So now we had hydrants in town instead of wells. Those wells, by the way, downtown especially, were used not only for drinking water or water for use in homes and residences, but they're also used by the fire departments to get water to fight fires. Okay, let me go to the next one. So, we talked about some of those diseases that affected Washington, Beaufort County, and eastern North Carolina in the early part during the 19th century. So let's talk about the Spanish flu that happened just a little over 100 years ago. The 1918 influenza pandemic was the most severe pandemic in recent history. It was caused by the H1N1 influenza A virus. That influenza killed almost 500,000 Americans from 1918 through the early part of 1920. In North Carolina, about 13,644 people died. From the spring of 1918 through the early 1919, the influenza pandemic ran through North Carolina. By April 1919, Dr. William Rankin, the Secretary of the State Board of Health and a noted proponent of health education, reported the death of over 13,600 North Carolinians from the influenza, and estimated that approximately 1 million of North Carolina's 2.5 million inhabitants actually had caught the disease. Nationally, the disease killed around 700,000 people, and 50 to 100 million people worldwide. It was called the Spanish influenza, and one would think that if it was called that it originated in Spain. And there's been quite a discussion over the years as to where it actually did originate. And there is good indication that it originated actually in the United States. A study by John M. Berry indicates a strong possibility that it first appeared in Kansas in January of 1918. Contemporary epidemiologist studies and lay history of the pandemic have identified the first known outbreak of the epidemic influenza as occurring at Camp Funston, now Fort Riley in Kansas. The most likely site of the origin was Haskell County, Kansas, an isolated and sparsely populated county in the southwest corner of the state in January of 1918. Haskell County, Kansas lay 300 miles to the west of Camp Funston. All Army personnel from that county reported to Funston for their training. Friends and family visited them at Camp Funston. The soldiers would go home on leave and return to Funston. As they traveled, and then as they would return back to camp, they would bring the influenza virus back with them to the camp. As the soldiers traveled across the country and joined other units at home and abroad, it is highly likely they spread the influenza virus around the United States and brought it to Europe when they joined the fight during World War II. The Allies did not want the enemy to know that the influenza was spreading among the troops, so they kept it quiet. It eventually spread to Spain, who was neutral during the war. Newspapers were free to report the epidemic's effects in neutral Spain, such as the grave illness of King Alfonso XIII, and these stories created the false impression that Spain was especially hard hit, thus the name for the influenza, the Spanish flu. At the height of the American military involvement in the war, September through November 1918, influenza and pneumonia sickened 20 to 40% of U.S. Army and Navy personnel. All right, by July of 1918, cases of influenza began to appear in North Carolina. Here is an article from the Greensboro Daily News talking about the Spanish or the Flanders grip. Now, that was another term that I wasn't familiar with and had to look it up. But grip was a term used at that time to describe an acute febrile contagious viral disease or virus disease. The epidemic spread so rapidly at first that health officials often could not do much except offer advice through newspaper columns and health pamphlets. Some of this looks familiar. They didn't sneeze in their elbow, but they said to use a handkerchief and to keep from spreading the flu. And it says the man with the concealed pistol is dangerous, but the man with the uncovered cough or sneeze is deadly. So cover your mouth, wear those face masks. Advertisements and advice on how to find relief were common in the newspapers. On the left is a notice in a newspaper. Actually, that's in a Washington newspaper, that they may use liquor in fighting the influenza. I'm guessing that that was at the beginning of Prohibition, and there was quite an amount of illegal liquor that was confiscated, and they were advocating the use of that confiscated alcohol, I guess, as a disinfectant, or maybe to drink. I don't know. And there were some grip germs smoked out by smoko tobacco cigarettes. So get that smoke in the lungs, and the smoke in the lungs will kill those influenza viruses in the lungs. And here's one: put a small amount of sulfur in each of your each of your shoes every morning, and goodbye influenza. So I don't have any sulfur around here, but just in case I do get the flu or maybe the COVID virus, maybe I need to go out and get me some sulfur. As it turned to late summer 1918 and it turned to fall, more and more news was being reported. And this is from Wilmington. Influenza epidemic is spreading fast. And this was late September the 21st, 1918. And in the city of Charlotte in late September, the health commissioner, whose name was Hudson, stated that they were ready for la grippe, or for the influenza epidemic that was traveling across the state. In October, newspapers declared that the disease was spreading rapidly across the state. In October, on October the 10th, 1918, Washington, North Carolina experienced its first reported death from the Spanish flu. His name was Gus Dillon. He was the son of Mr. and Mrs. R.J. Dillon. Doctors estimated the number of cases to be around 200 with a steady increase. In town here, schools, churches, theaters, picture shows, and places of public gathering were ordered closed. Sound familiar? Social functions were postponed indefinitely, and for some reason they stated explicitly in this article that women's clubs are not permitted to meet. So I'm not sure why that is the case, but why they seem to single out women's clubs, but they did. Gus Dillon's death certificate, I'm behind one, I'm sorry. Gus Dillon's death certificate showed his cause of death as pneumonia with influenza as the contributing factor. By mid-October, events in Washington and the federal courthouse were postponed until January. Liberty Loan Drive was going on, trying to raise money to fight World War I, and it was postponed. People couldn't go out and solicit or sell the bonds, and the federal court in Washington was postponed, which was held in today's City Hall. The upstairs was the federal courthouse. Dire reports were coming in from around the county how the flu was affecting the rural parts of Beaufort County. And if I can read this, it says about 30 deaths have occurred in the rural sections in the past 3 or 4 days. The members of the Red Cross have lent material assistance by carrying groups and other nourishing foods to the needy. The ladies reported that they rarely found a single farmhouse where there were no sick ones at all. In most cases, several members of each family were in bed. So numerous are the cases, it is impossible for the physicians to reach all of them, and many are dying without ever having had assistance of a doctor or nurse. Excuse me. I went through and looked at some of the death records or certificates for Beaufort County in October, and these are just a few of them, but they occurred, of course, all over the county. Here's one. It says the cause was influenza. Here's another one, epidemic influenza. That one was from Aurora. And here's one from Pamlico, pneumonia following influenza. I went through and counted the number of, I was using Ancestry.com and searched for death records in Beaufort County in October of 1918. And almost, I would say, 75% of the ones that I saw, and I didn't get through them all because I ran out of time, but 75% listed the cause of death as influenza or pneumonia from influenza. And I was keeping a tally, and I quit at about 50 because I ran out of time. So I know that at least around 50 people died just in October in Beaufort County from the Spanish flu. And if you look at this chart at the very bottom, it shows the number of deaths from the Spanish flu in North Carolina. And you can see that it peaked in mid to late October. Of the number of cases were 12,259 in October the 19th and 361 deaths. You know, that makes the number of deaths in Beaufort County, from my count, seem a little high, and maybe it is, but still, all the deaths in November or October, excuse me, there still were a very high percentage. And I noticed that it affected every demographic across the county, and also all different age groups, from infants all the way through people who were in their 60s, 70s, and 80s. It was so bad that the publisher of the Elizabeth City Independent newspaper wrote in February of 1919, which the pandemic was still going on. He said, "Let's quit shaking hands. It is a filthy, abominable habit." I knew I was going to say that. From the barbaric past. Having served its day and purpose, it ought to relegate to oblivion. And that was in February of 1919. And ironically, here's a quote from Dr. Anthony Fauci. "I don't think we should ever shake hands ever again, to be honest with you," he said in a Wall Street Journal podcast. "Not only would it be good to prevent coronavirus, it probably would decrease instances of influenza dramatically in this country." So, today, where are we? Without an effective treatment for COVID-19, we're forced to use the same measures that our forefathers used to lessen the spread of disease. Number one, isolation or quarantine, social distancing. It's a good thing they don't have pest house. I don't want to go to the pest house. And hand washing and face covering. So I'm hoping that everybody out there stays safe, practice social distancing, wash your hands for 20 seconds, and wear that face mask. If anybody has any questions, I'll be glad to try to answer them. If you'll send a comment, I'll try to respond to it. And there's a little bit of a delay, so it might take a few seconds for me to respond. Chris Donahue, no, I wouldn't want to go to the pest house either. Thanks for watching, Sandra. I appreciate it. You're welcome, Chris. Thanks. I'm going to switch over and stand outside down at the waterfront. Kathy Witchard, I did not find anything on infantile paralysis in the 20s. I was limited to access to what I could get to online, and the old newspapers that I have access to don't go through. They stop about 1920, and I didn't, so I couldn't really get any information about it. Infantile paralysis in Beaufort County. Thank you, Lisa. I appreciate you looking in, watching this again. It's getting dark here at my house, and I don't have a light on, so I'm starting to fade out here. And my light here is not working. I think the battery is dead. I don't know. Maybe it isn't. There it's coming on. Yep. Okay, guys, I'm going to assume that there aren't any more questions, and I am going to sign off here. Thanks for watching. Um, maybe we'll do this again. I don't know. We'll see. Oop, I'm getting some questions. Okay, Ellen Nunley. Swimming shot and a typhoid shot. I don't know. I would guess that that could have been a typhoid shot that you got before you could go swimming in the river. Very possible. And Joan Cottle, uh, I, I mentioned that the first hospital in town was I think it was the Fowl Memorial Hospital on the corner of 5th and Market Street. The and that was in 1902 when it opened up. So before they had a hospital, people were either treated at home or they were taken to the pest house to recover. And Mary Walter Rumley, yes, another program. I may do this again. I think I managed to stumble through this without too many hiccups. And the hard part of this, of course, is doing all the research and getting all that ready. And I'm not a health professional and don't know a whole lot about the history of public health. So I had to do a lot of reading. Thanks for watching, John. Thanks, everybody. I am going to say good night. Hope to see every one of you soon.